This video is solely for the purpose of a college health assessment course.
Can I come in?
Sure.
Okay, I'm going to close this door for privacy, and I'm going to wash my hands. I'm Alex. I'll be your student nurse today. Can I see your wristband, please? All right, and can you tell me your name and date of birth?
Chelsea Jones, 9/21/87.
All right, great. So today we're going to be doing a health assessment and a physical exam. Is that okay with you?
Yep.
All right. Great, and let's get started. So, can you tell me a little bit about the reason that you are seeking treatment today at
I was just looking for a physical exam.
physical exam?
Mhm.
Okay. And how would you describe your current health status in a few words?
I'm pretty healthy. I like to keep active and eat well.
Okay. And do you have any concerns or complaints today that you want to address during the exam?
Not today.
Not today? Okay. All right. And do you have any current medical conditions?
No.
No. Any chronic illnesses?
No.
That you have? All right. And can you tell me about any current medications that you are taking over the counter, prescription, vitamins?
Just Advil when I need it.
Advil as needed?
Mhm.
Okay. And do you have any allergies to medications,
No.
food?
Mm-hmm.
No allergies?
None.
Okay. And are you currently receiving any medical treatments?
No.
No. So we're going to go over your past health history. So as a child, did you have any measles, mumps, rubella?
I had the shot for that, so
The
I
shot?
didn't have that.
Okay, so you had your immunization. What about chicken pox?
I did have chicken pox.
Okay. And about how old were you?
4.
4? Okay. Did you ever have the flu when you were younger?
Yeah. I mean, not every year, but occasionally.
Occasionally. Okay.
Mhm.
And what about ear infections?
Yeah, a few when I was little.
Okay. Any throat infections?
Yes.
Yes.
Plenty. Yeah.
Plenty, a lot. So
A lot,
more
a lot.
than.
Yeah, like a lot of strep, a lot of like bacterial infections,
Okay.
and that's happened since I was little until I was 26.
All right. Any previous or recent hospitalizations?
Well, I had my wisdom teeth removed in March, so I
March.
was outpatient.
Outpatient. Okay. And any previous surgeries besides the wisdom teeth?
I had a tonsillectomy.
Tonsillectomy. Okay. All right, so we went over the measles, mumps, rubella vaccination. Are you up to date on all of your other vaccinations?
I think so.
Influenza, HPV?
Yep.
Yep, okay. All right, and what was the date of your last physical exam?
It was sometime in January or December,
January.
somewhere around there.
Okay, and what was that physical exam for?
I got into nursing school, so it was
Oh.
just a routine physical.
Okay, great. Congratulations.
Thank you.
All right. When was your last menstrual period?
It was last Friday.
Last Friday.
Mhm.
Okay. Any previous pregnancies?
No.
And when was your last Pap smear?
Ooh, September 2013.
2013. Okay. Are you getting those yearly?
Yes.
Okay. All right. Now we're gonna go over some of your family history.
Okay.
So, have either of your parents had any chronic illnesses or diseases?
No.
No? Okay.
Mhm.
Are they both alive and well?
Yep.
Okay, great. And what about your grandmother on your mother's side? Any chronic illnesses or diseases?
She has a bout of depression and then some heart issues and then an autoimmune deficiency.
Okay. And what about your grandfather on your mother's side?
He's passed away.
He's passed away, okay. And when did he pass away?
2000.
2000, okay. And what was the cause of his death?
He had COPD
COPD?
and just other like heart-related diseases. He had smoked his entire life, so he was just not the healthiest.
Okay. All right. And what about your grandmother on your father's side?
She's passed away as well.
Passed away. Okay. And when did she pass away?
2004.
2004.
Mhm.
Okay. And what was the cause of her death?
She had emphysema, so I
Emphysema.
think it just kind of progressed to where she couldn't really breathe anymore.
Okay. And your grandfather on your father's side?
He's still alive, but he has diabetes.
Okay. Any aunts or uncles on either side of the family have diseases?
My dad's brother died from a heart attack.
Okay. And when did he pass away?
When was that? It was like 2006, maybe?
Okay. All right. And any siblings have any chronic illnesses or needs? Okay. All right. So now we're going to go on to your personal and psychosocial history. Are you single, married? What's your marital status?
Single.
Single. Okay. Can you tell me about your living situation?
I live in a house with a roommate
Okay.
and a couple of cats.
Okay. Any changes in your diet or nutrition?
Not recently, no.
No. Any weight gain or loss?
Nope, not that I've noticed.
Okay. And any tobacco use?
No.
Any alcohol use?
Socially.
Socially? Okay. And about how many drinks per day? Or per week?
Day.
Per week. Per week.
No more than 5 a week. I'd say like 2 to 5.
Okay. All right. And now we're going to move on to your physical exam.
Great.
Okay. So I'm going to start by checking your skin with your hands, and the skin is warm and dry to touch. We're going to check for moles. You want to go over the ABCs, the area, border, color, diameter, and elevation. So if you notice any changes in any of those, just let us know next time. But everything looks normal. We're going to check the capillary refill, and it is instantaneous, which is good. The skin turgor, and that is also instantaneous, so the skin is nice and hydrated.
Good.
And we're going to check your radial pulse for 15 seconds. And then we're going to move to the other side. Check this arm as well. And check capillary refill. Good. Skin turgor, instantaneous. And then we're going to check radial pulse and respiration rate. So we're going to do the radial pulse for 15 seconds and watch breath rate for 15 seconds. And then we're going to also check the brachial pulse on each side for 15 seconds each. Then we're going to move up to the head, neck, and scalp area. We're going to do the carotid pulse on each side. And then when you're going over, you want to make sure you don't compress the trachea. Then we're going to check the scalp for any lesions, infestations. The hair is not brittle. And then we're going to check inside the mouth. And the skin is pink and moist, so that is good. Now we're going to check heart or breathing sound, lung sounds. We make sure the stethoscope ear plugs are facing forward. I'm going to start above the clavicle, and when I place the stethoscope on your skin, breathe in through your nose and out through your mouth. And on this part, we would be doing this on the skin, not over the clothes. Then we're going to check breath sounds over the trachea for bronchial sounds. And as we're doing this, we're going to make sure the trachea is centered and in the correct anatomical position. And we're going to check the bronchotesticular breath sounds. And then while we are up at the front, we're going to do heart sounds. So on your right, you're going to find the angle of Louis and go over to the second intercostal space. And this is the aortic valve. And you're going to listen for a minute. Then on the left intercostal space, you're going to listen for the pulmonic valve for a minute. Then in the fourth intercostal space, you're going to listen for the tricuspid. And then fifth intercostal midclavicular. I forgot it. Can we edit it?
Maybe.
We can.